When we talk about sudden cardiac arrest, so when a person gets a sudden cardiac arrest, okay, we're all different human beings, okay? One can look like Asterix, small guy, or one can look like Obelix, okay? So we're all different persons, we all need different treatments, okay? It's like when you go to the dentist, open up your mouth, and then you will have your special treatment serving you. Same with a defibrillator. Our defibrillators from Cardiac Science are the only AEDs or defibrillators in the world who individually treat Obelix and Asterix. Okay? They make a special treatment for every individual person, regardless how big you are, how small you are, how tall you are, how little you are. It doesn't make any difference. Individual treatment of the patient, which is very important, because only that way we can save persons the most fast and most efficient way. Okay? So now I will show you how the product actually works. What we have here is the PowerHeart G3 from Cardiac Science, and a defibrillator or an AED consists of three very important items. We have here the battery that serves as the energy provider to the device, because without any energy there's no way that you can actually save the patient again by giving new energy to the heart cells, so that's a battery. Inside of the device, when you open it, you have the actual pads or electrodes that look like this, where you put the actual electrodes on the patient. So one you put here on the upper chest and one on the lower part. So there's one and two. The third important thing in a defibrillator is the actual inside the brain of the defibrillator or the AED, what we call the circuitry, so the software. This is very important because that is the way that the machine will determine when you have the pads on the patient, if the patient has a sudden cardiac arrest rhythm or not, meaning is it then safe to use the actual pads, okay, and the defibrillator. So let me show you how this works. First the battery. So when you open up the device, the machine will start talking.
Stay calm. Follow these voice instructions. Make sure 911 is called now. Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner. Firmly place the pad without the liner on the patient,
place on the patient,
exactly as illustrated. This pad can be placed on either of the two locations shown. Next, peel the blue plastic liner off of the second white pad. Press pads firmly to patient's bare skin. Press pads, do not touch patient. Press pads firmly to patient's bare.
So here, to take a break here, now I will cheat the machine, okay? Because now we have a patient here, a simulator. Okay, this is the simulator that will simulate a real sudden cardiac arrest. So the situation is now, I have now placed the actual pads on the patient. Now you will hear the machines to start analyzing the actual heart rhythm of the patient. So now I will tell the machine this patient has a VF, with a ventricular fibrillation, which means the patient is in a sudden cardiac arrest situation. So now you should watch what the machine is doing. Okay. So now the machine will believe we have a patient with the pads on.
Stay calm. Follow these voice instructions. Make sure 911 is called now. Do not touch patient. Analyzing heart rhythm. Please wait. Preparing shock. Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. When instructed, give patient 30 rapid compressions. Then give 2 breaths. Place heel of one hand on center of chest between nipples. Place heel of other hand directly on top of first hand. Lean over patient with elbows straight. Press the patient's chest down randomly, 1/3 depth of chest, then release. Start CPR. Press press, 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 press,
Okay.
press, press, press,
I'll now
press, press.
turn off the device. So this is basically how it works. So in a very few steps, you get to the patient, you open up the device will activate itself. You take the pads out of the machine, place them on the patient. The machine then analyzes the heart rhythm. If the heart rhythm is in a sudden cardiac arrest situation, then the machine will tell you to push the red flashing button to provide a shock to the patient. And for the layperson, for the rescuer, there's absolutely no risk. You only place the patch and push the button. There's no risk for you as a rescuer that you get any kind of energy shock. It will only be done to the patient. So you do the compressions, wait for the next voice prompts from the unit, and follow the unit and the instructions.